My capstone project will focus on the effectiveness of cognitive processing therapy and mindfulness on a client with PTSD. Post-traumatic stress disorder is a chronic, often debilitating mental health disorder that may develop after a traumatic life event, such as a sexual assault or unexpected loss. PTSD is associated with a wide range of problems, including difficulties at work, social situations, physical health problems, and there are several effective therapeutic strategies for PTSD available. Still, there is also a need for alternative treatment modalities for clients that do not see results or have access to counseling services. By having the clients cognitively restructure unhelpful thoughts, they can dramatically change the way that they feel, improve quality of life. Cognitive processing therapy sessions improved significantly from pre to post-treatment on both PTSD and depression measures and maintained their improvement for 6 months. There is also strong empirical data supporting the efficacy and effectiveness of CPT in its various forms with different populations. Studies by Kearney, McDermott, Malte, Martinez, and Simpson suggested that related findings suggest that rumination can be reduced by mindfulness practice that enhances the present moment, focus of attention, and a non-judgmental stance toward one's inner experiences. Due to the client's symptomology, CPT and mindfulness practices are the modalities that will be used in her course of treatment. The participant in this case study is a 29-year-old African-American heterosexual client diagnosed with PTSD and generalized anxiety disorder. The client has experienced traumatic events which have significantly affected her daily functioning. She experienced a shooting with her son, and she was sexually molested when she was 7 or 8 years old over the course of an entire summer by her first older cousin. She has been experiencing difficulty with symptoms such as depressed mood, unwanted memories of trauma, anxiety, irritability, anger outbursts, flashbacks, mistrust, intrusive thoughts, hypervigilance, poor self-image, low self-esteem, sleep disturbances, racing thoughts. This is a longitudinal case study of the client for 10 consecutive weeks. She would see the client weekly on Friday afternoons. Due to the client's symptomology, she can greatly benefit from CPT and mindfulness practices to reduce the stress level when discussing traumatic events and restructuring cognitive thoughts that are the most affecting her daily functioning. Some of the interventions that I implemented with this client: strengthening the therapeutic alliance to provide a safe and supportive space for the client. Provide the client with psychoeducation about PTSD to discuss the diagnosis and process feelings, and just discuss any questions that she may have about the diagnosis. And actually also giving her handouts for monitoring her mood, warning signs, and triggers. Discuss and process past trauma events and identify triggers, thoughts, and bodily sensations associated with those triggers. I also provided information on practicing mindfulness techniques when in distress to increase awareness, acceptance, and self-empowerment. The client and I discussed and processed her past traumatic experiences. The client was sexually molested for an entire summer by an older first cousin over the course of a summer when she was on vacation. She also witnessed a shooting with her 6-year-old son while she was also pregnant with her second son. The client was often observed crying and shaking her leg when discussing her trauma and cognitive distortions associated with the trauma. The client was then asked to assess her distress level before and after a mindfulness exercise. The client and I identified the most unhelpful thoughts about her traumatic experiences utilizing the Post-Traumatic Cognitions Inventory. The PTCI is a 33-item scale, which is rated on a Likert type scale ranging from 1, totally disagree, to 7, totally agree. The 7 cognitive thoughts that most affect the client's daily functioning are: people can't be trusted. I have to be on guard all the time. You can never know who will harm you. I have to be especially careful because you never know what can happen next. The world is a dangerous place. Somebody else would not have gotten into this situation. And the last one, I can't rely on other people. Distress level will be recorded on a scale of 0 to 10, which 0 means no distress, and 10 meaning that there is significant distress at that time. Distress level will be measured before and after a mindfulness intervention. Quality of life will also be documented during the study to provide additional information on the factors affecting daily functioning. Over the course of 10 weekly sessions, the client's distress level eventually decreased after restructuring cognitive distortions and practicing a mindfulness exercise after discussing the traumatic events. The client reported experiencing an increase in the quality of life by practicing these treatment options consistently during sessions and often in between sessions when she is triggered. The results were not linear due to external factors affecting self-reported. The graph shows 2 lines documenting the client's distress level before and after practicing a mindfulness exercise to reduce stress and distress in the here and now during a counseling session with the client. The graph shows that it was difficult in the beginning, but the client's distress level eventually decreased, and she reported an improvement in quality of life due to restructuring cognitive distortions and gaining acceptance of the trauma and regaining power over it. Other effective treatment modalities for PTSD clients are prolonged exposure therapy and eye movement desensitization and reprocessing therapy. PET requires the most time-intensive homework, and EMDR may leave some clients skeptical of its effectiveness in therapy. The client reported that she was not ready to engage in more intense modalities. This client would have to continue with cognitive processing therapy and mindfulness-based interventions for the course of her treatment. The client will continue to monitor mood, symptoms, and warning signs to avoid any future hospitalization and a relapse in symptoms.